So we're going to start with a Volar splint, which runs from the palmar crease to 2 inches distal to the elbow, which for me is about 2 fingers. So we're going to go straight down. This is for fractures where they're not necessarily worried about preventing rotation of the arm, so it's just going to be on this anterior surface of the arm. So what we're going to start is by measuring the distance that we decided. We'll save this piece and cut for later. And then we can apply our stockinette. And go all the way over the arm. You do want to keep in mind when you pull stockinette over somebody's arm that they may be having pain. So just where you're putting the stockinette, be mindful of any bruising, swelling, or specific pain sites. Lift up above the thumb, snip it off, and you can slip this thumb right through without losing any landmarks here. If you don't know where the palmar crease is, you can always bend the fingers down, and that'll naturally create a crease. Next, we can start padding the arm. You should start by padding distally to proximally. I start right here at the base of the thumb and wrap around. On the back side, I tear halfway up, cross over the thumb,
Are you guys doing trainings today? Is that what this is?
and then flip the hand back. We don't want to have any overlapping or big wrinkles in our padding down low. Next, we'll go underneath the base of the thumb and tear that off. For the rest of the hand's padding, I like to go a little bit smaller. You can do an accordion over the thumb on this one, which is where you use your little thumb and index finger, pinch these together, lay them flat, and then once you cross the thumb, you can continue wrapping this back around. We want 3 layers of padding between the material and the skin. Does that make sense? Not really. So 3 layers of padding between the splint and the skin. So since we have our hand well padded, we're going to pay attention to our padding and make sure that we can maintain rotation of the thumb. And then we can go ahead and start on the arm. We're going to be careful to prevent any wrinkles. You can pull this a little bit taut without making it too tight. But the good thing about this web roll for padding is that if it's too tight, it'll most likely tear before you can do any circulatory damage. We're going to come back around, and with all these overlaps, we're going to continue to check for wrinkles. Make sure there aren't any, but we're definitely getting our 3 layers in. We've returned to the wrist, we can tear that off, and then we'll cut the splint. So there's 2 options for hiding the fiberglass at the end of this splint. The first option, which I'm going to do on this side because this got left out and dried, is to fold back the 2 protective layers and then just trim a little bit off here. So we've cut that off, we've got nice soft fiberglass underneath here. What we're going to do next, when we bring that layer back around, I like to tuck it around, and that way the thick side goes toward the patient's skin, but it's going to cap any remaining tiny little pieces of fiberglass. It'll prevent the patient from getting a fiberglass splinter, which are very painful and hard to remove. The other option for finishing an end, we've got these little loose pieces of fiberglass here. We can always just separate this and then roll it in on itself. Because this is still fresh out of the bag, it's very sticky, and with just the tiniest bit of pressure, the fiberglass will stick to itself, and that prevents any sharp ends from poking out at all. So this is the preferred way to cover the ends of those fiberglass and protect the patient's skin. If you're going to get a splint wet to activate it, which is recommended, you only need a tiny bit of water. A lot of people make the mistake of trying to put the water on the outside of the splint. What that does is saturates the outside. Some even people put it on this side, which will help the patient to have a wet arm for a long period of time. You just need a tiny bit, on the inside. A tablespoon or so, 2 tablespoons if it's longer, should be enough. And you start to work it down the splint. Make sure you touch every piece of the fiberglass inside. Just needs a tiny bit of water to get that activation going. The moisture in the air will actually activate the splint all on its own, so it really doesn't take a lot. So we're going to make sure that we're still at the palmar crease, which we are, but we've got this big thumb overlap here. So 2 things you can do. You can slightly roll this in to give the thumb full range of motion, but if that overlaps onto the fiberglass, then we won't want to do that. We would want to cut this out and then protect the edges of the fiberglass with either web roll or this outer thick layer here. But because the fiberglass isn't really overlapping underneath this, we're still okay to use this fold. We'll bring the end of our stockinette down on either side. And if this is a little bit long, we can always recut. Training purposes, just fold this. Nice and flat, even surfaces here. For the thumb side, we're going to need to cut a small thumb hole in our stockinette on the outer layer in order to make this a good fitting and nice looking splint. So if you're going to cut a thumb hole, make sure that you cut in more than one direction on this outer piece so that the patient has continued range of motion. If you aren't super coordinated and have a hard time doing this on your own, web roll can definitely be helpful to you. You can add just a single strip of web roll, which helps to hold that splint on. You can use it high or low if you need, and it just kind of keeps things where they're supposed to be. Now for a volar splint, we're going to double check. We're 2 fingers from the elbow. We're at the palmar crease here, but we do want to turn the hand and very, very gently do a cock up here, just a tiny bit. You want to make sure that you don't put a ton of pressure on any specific spot, but instead just lift the wrist, maybe 15 degrees or so, by your doctor's direction. We'll hold this until the splint starts to get warm. Patient can feel it activating underneath. And like I said, it didn't take a lot of water to get this going. Once that has cured to where it will stay up in that position, you can go ahead and grab your bias and we'll secure the splint. So they want us to secure the bias distally to proximally. So I kind of start this the same way that I would the web roll for our padding. But the first thing that I do will cross underneath the wrist, underneath the thumb, kind of secure this piece here, and then we can come back up and do some cuts for our thumb hole. So slip the thumb right in there. And then we don't need a ton of layers of bias. There's 2 reasons that we use this. 1, to hold the splint on, and 2, it's a little bit more aesthetically pleasing. So you do want to make sure that this looks good. We want the patient to go home with a high quality splint regarding placement, but we also want it to look decent on them. So 1 to 2 layers is fine. When you get to that point, cut it off and do your taping.